do you want to share anything on your side as far as your testing out in the field? I know that you have been working with it so far. Are they continuing to send you supplies, or how is that program going?
So are we talking about the Abbott ID Now or Binax?
Abbott the ID Now, excuse me.
We received our last allocation, and so kind of keep that in mind as we work through the last of them. I'll be contacting everyone to see where you're at, what other resources you have, because as we use this last little bit of supply that we have, I want to be fair to people that don't have other ways to test. Um, for instance, they don't have an in-house method, and so I'll be trying to divvy that last allotment out.
Okay, thank you. So I kind of wondered about that. And of course, the second system out there the state has supported is that Binex Now. I know that that system is integrated primarily in your long-term cares, but many of you have worked with that system. Um, I don't know how much longer that system will be supported by the state. I think they've been awfully quiet lately, so I do fear that it may not be. But in the meanwhile, I did want to take a moment and share a new, maybe you already know of it, but it is a system or a playbook. It is the state's plan for doing the Buy Next Now. And I actually thought it was well written because it included a lot of laboratory information for the long-term cares, and it assisted with things that they're probably not used to, such as QC or maintenance or reporting. So well thought out document that if you maybe consider keeping the Binex Now, you can continue to use it, but it's also a great format that you can use and rewrite essentially for maybe other point of cares that you have. Again, I thought it was a very complete book. So this was written here back in probably October, but that is the newest edition or the most recent edition that we have out there. If you have not seen this, I believe it is on our website. If you'd like a copy, which is not PDF, but in fact a template for other point of cares, please feel free to email me. Another item I wanted to share really quickly, just going through these, of course, here, can you see the our interpretation of antigen results for the long-term cares? Is that up on your screen?
Yes, it is.
Thank you. So this is what DHHS had put out to assist the long-term cares, but also I think it is a great means for us as laboratorians as we use point of cares. But thinking about what kind of personnel is administering the test, what kind of course, in long-term care, it's easy for them to know what their patients are if they're symptomatic versus asymptomatic. As a laboratorian, you may not, but if you have access to whatever hospital information system is, you can go ahead and look to see what some of the patient symptomologies are as to how to interpret some of the more iffy or questionable results. So again, that's just some information that we have out there, and a little bit late to the ball game to really share it, but I just thought I'd let you know it is there. All right, going back to our agenda again. All right, thank you for continuing to sign in the chat box as you do come on. I appreciate that information that you put into the chat box and who's attending today. So any questions about point of care? I'm going to open it up to see, hit your unmute and let me know if you have any questions.
This is Gerald. So this is still, Binax is still under government allocation, Tony, or is that being rolled over as we speak, probably into regular commercial distribution?
The Abbott ID now is, our allocation is over. So we aren't getting any more, and they should be available commercially to you. I'm hearing from people that they're started to come in fits and starts, and now it's a little more reliable. So my program is over. I'll just be distributing what I have left.
Okay, and do they, Tony, do you know if they have a succession plan for these laboratories that currently have these boxes or these kits, if they are offering it to them at the same price?
We aren't being charged anything for the kits, so these have been provided to labs at no cost. But they've been signing individual contracts with Abbott.
Okay.
So as our allocation has dwindled and stopped, they should be able to be filling the commercial orders at this time.
All right.
That's Tony. That's a great GPO, no cost. That's better than mine.
Well, it didn't cost MPHL anything, so yeah.
Right. Right. Any other questions? All right. Okay, then I'd like to go on to the MPHL laboratory status. And Emily or Pete, are you on today?
I believe we are both on, Karen.
Awesome, thank you so much.
NPHL is continuing to work for supporting your COVID testing needs. As you guys know, on December 1st, we implemented a multiplex assay here in-house that tests for influenza virus types A and B, as well as COVID. Just know that if a specimen is submitted to you and you get back an influenza result, that does not mean we did not test it for COVID. That would indicate that it was negative for COVID. If it was positive for multiple pathogens, it will say both pathogens listed in the overall interpretation on that. So I did want to note that. Apart from that, we are just continuing to try to get things back to more of a normal rhythm for us so that we can continue to support all of the exciting things that we help you with throughout the year. Pete, do you have anything to add?
I agree, Emily, with what you're saying. I think that just to talk, I know you have on your agenda, Karen, about the variant strains. We are looking at sequencing a certain number of positive COVID samples to look for these variant strains, which is a program that has been set up with the CDC. One thing to keep in mind, because we keep hearing it, is that most of the laboratory tests that are out there will detect the variant strains. So they will call the samples positive, but they will not identify the variant strains without sequencing. So, you know, the point is that we're going to pick these up. We are looking at hot spots in Nebraska that might suggest that there's a higher level of transmission in these areas. Taking some of those samples and looking for the variant. At this point, I believe we have not, well, I'm not aware of any variant strain being detected in Nebraska. Have you heard anything more, Emily?
That is correct, Pete. Thank you for moving on to that second bullet point.
Yeah.
As of now, we have not identified the variant strain here in Nebraska, but as you all may have heard, it has been identified in Colorado. It was actually the first place that it was seen. We are actively working with the state for screening of different specimens and positives throughout the state. We identify sites that are noting a significant quick increase in positivity rate, and we're testing specimens specifically from those sites as well as a general surveillance. And we are trying to identify if this variant is here in Nebraska. I just saw someone note on the bottom that it's been identified in Wyoming. Yes, it has. I believe the last update I looked at on Friday, it was identified in 8 or 9 states throughout the United States thus far. We have every reason to believe that it is likely here. We have just not identified it. But what I want to note is that all of your laboratory testing platforms will still be able to detect this pathogen. They will not be able to identify it. There will be no result that comes through saying, hey, this is a weird result. It might be your variant strain. It will simply come through still as a positive for coronavirus. The only true way of identifying that would be through next generation sequencing, which we are doing here in our lab, as well as coordinating with the CDC for further national surveillance on as well. But as for how this variant would affect your own testing platforms, they should still accurately provide a positive results for a coronavirus specimen containing this variant. You should not be getting false negatives on either this variant or the South African strain.
Correct. Correct. Good overview, Emily. I just want to add also with the multiplex for COVID and influenza, we probably have tested over 12,000 samples by now with the multiplex. And what have we seen? Maybe 4 positive influenzas that more than likely represented a vaccine flu mist positive cases. So influenza seems to be lost somewhere. I don't know. We're still expecting it to show up. But at this moment, we've done a lot of testing and have not really picked up true cases of influenza.
Okay, well, thank you for that information. So Emily, just to make sure that we understand correctly, that when there is a possible variant, the laboratories will be able to detect it just as any other positive. They don't necessarily identify it as one of those other variants. So how would they know? How would they know to send it in?
There is nothing that would actually indicate to them that they would need to send it in, which is why I said we're working with the state on identifying sites that are exhibiting quick increases in positivity rate. What we know about this variant is that it is highly transmissible, but it is not more virulent. So that is at least good. So a quick increase in positivity rate could indicate a viral strain circulating that may have a higher transmission rate. That is where we are focusing some of our sites. And if your site has been identified as one of those that is exhibiting that, the state will be in contact with you for submission of specimens to Nebraska Public Health Lab so that we can do further analysis on them.
Correct. And one thing I want to emphasize here is we've had a number of requests from physicians wanting us to test their positive patients to see if they're infected with the variant strain. That is not something that we are prepared to do, start testing individual cases because of physicians' requests. So keep that in mind also.
Okay, yes, yes. I had heard something unusual this morning on the news about California also reporting yet again a different variant. They felt it was, unless I misunderstood, but it was quite evident in the state of Colorado or of California. Anything about that?
I haven't heard anything, but you know, viruses mutate, and especially RNA viruses love to mutate.
Right.
We know that there's mutations occurring. We have been looking at other cases in Nebraska, such as the packing houses. We've looked at those isolates to see if there's mutations there. We've looked at some nursing homes for other types of mutations and have seen them. In some cases, we think the mutations are actually creating a virus that is less virulent. So it's really quite interesting, but mutations occur. Nobody knows for sure what effects these mutations have, but in many cases, it's not an effect that's causing them to be more infectious.
Okay, yeah, makes sense. So I'd like to open it up to you all out in the field, if you have questions for Pete or Emily regarding the variants.
This is Gerald from Syracuse. So I heard that like, Thermo Fisher's, which none of us obviously in the state probably run that one, or then Quidel's Solaris has like an S target, and that is affected by it. So I would assume that might give them a heads up if they have a couple targets and that the other targets are consistently being picked up and the S one's dropping off. That would be a heads up. Is that why?
Yeah, we're well aware of that in the public health lab. We did a survey of the laboratories in the state, or Karen did a survey, and there were no laboratories that were using the Thermo Fisher TAC path assay, which is one that you can detect this, what's called an S dropout target. What we actually do in the public health lab is if we have positive samples that are suspicious for this variant strain or any of the variant strains, one of the things we will first do is we will run a TAC path. We have it available in the public health lab. And if we do see an S dropout, then we will submit that for sequencing. I don't believe at this point, we've run quite a few of these. Emily, you can correct me, but I don't believe we've seen an S dropout with the TAC path assay in our lab.
That is correct. We have not seen any specimens exhibiting that S dropout. The reason we run this TAC path assay on those specimens of interest is because it's a quick and relatively cheap way of determining whether or not this strain present in that specimen does exhibit the S dropout, which would be indicative of the UK strain. If we were to do it by the identification method, next generation sequencing, it would take multiple days and it is a very expensive assay. So we did get the TAC path assay here in-house at the Nebraska Public Health Lab in order to perform that screening so that we can identify the best possible specimens to go on for next generation sequencing.
Right, and we're using it as a screening test. We're not using it routine care. We're not validating it for routine testing of patients. We're only using it as a screening of these high risk samples. So good question.
Any other questions? Thank you, Gerald. Any other questions in general about laboratory? Or questions on New Alert? I think I have one more new message. Diane has asked if anyone is doing the IgG testing for COVID. We can do it on one of our analyzers, but under interpretation, it says it does not distinguish from the COVID from other coronaviruses. So I'm hesitant to move forward in this situation.
So keep in mind that serological testing is not diagnostic testing. It's only for EPI to determine who might have been infected. We do not offer any serological testing through the public health lab at this point. The CDC has not really endorsed any of these assays at this point in my mind. If you do want to do IgG, you can probably get them done through your reference labs as well. I believe Nebraska Medicine also offers an IgG test available, but at this point, there's so many unknowns with serological testing that we really have not got involved with it in the public health lab.
Yes. Diane, I don't know if that helps you, but I understand your dilemma here.
Yeah, and the issue of it doesn't distinguish it between the other coronaviruses is true in many cases. A number of these serological tests that have been approved by the FDA under an EUA designation over a period of time, some of these now have been dropped because they weren't that good, that accurate. So accuracy is an issue with a number of these assays. I can't tell you which one I would pick if I even wanted to pick one of them. There's probably 30 or 40 of them out there. But there certainly are a lot of people knocking on my door wanting us to put their assay in place, and we just aren't to a point where we're going to do it.
Certainly. And I suspect the laboratories here in Nebraska may be experiencing the same thing.
And we don't know what effect the vaccine is going to have on serological testing either, which is a whole nother side to this.
Yes.
Yeah, and
thank you.
then the question where my interest was more to follow up on the vaccines was the question, and vaccinations. And again, nobody seems to have very good handle on what serological tests will even detect the immunological response to the vaccines.
Yes. Thank you, Pete. We also have a question from Bill Bolte from York, Nebraska. Are there airlines and airports designating which serology tests are or are not acceptable?
I am not aware of any that even serological tests can be used by the airports. They're looking at well, they used to be looking at the PCR assay testing only, and I just noticed more recently they're also accepting antigen test results, which is kind of interesting because those have such low sensitivity. So I'm not sure how they're getting by with that. But yeah, I'm not aware of airlines using serological testing in any way of monitoring passengers.
Something I also know of the airlines, as this new vaccine comes out, you will be getting from a little card that is a CDC document that I have been told you can use at the airport as documentation that you have been fully vaccinated. Once
Aaron, I'm going to laminate my card so I can put it in my wallet. That's how important I think it is. But
yes, because I was told this was going to be our passport in the future to be traveling. So definitely something that you do not want to lose. So good idea to laminate.
I think that was your idea, Emily, wasn't it?
Yep, the whole team is lining up at the laminator.
Yeah.
All right. All right. Thank you. Any other questions for any topic laboratory-wide? All right. I just have really a few other items that I'd like to share with you. These are primarily laboratory training. So if you don't have any other questions, I'll go ahead and get started with that. So one last request. And if you think of one later, just put it in the chat box and we'll revisit later. So we have sat down to rethink laboratory training in 2021. I remember doing the same exact thing for 2020. I had a schedule out, never even approached it. So dug it out again and revamped it quite a bit to kind of talk about or to hit upon some of the things that we have missed in 2020. Definitely we will get back onto the schedule of the challenge set. I apologize, we just did not get to it this year. Believe me, I tried, but for those laboratories doing the challenge sets, we will start fresh here in 2021. The LPX managed to get out. It was late on its first installment, but it is now rescheduled for April and September. So just to kind of go through my list, first of all, any general questions, as you know, you're welcome to email any of us. We have our general group email box, which is the nphl@unmc.edu. You can call us. We have a regular phone that really does roll over to a number of us in order that you can get a live person on that call. And if that person doesn't know, of course, they can go search, or will be searching for the person who does know the information. Also, I will be opening up my Zooms before the statewide lab call. I'm usually on it at least an hour before. So if you have any questions, feel free to drop in at that time, and we can work on an answer to your question. As far as actual training, you'll be getting an announcement for the following. And that is, we are going to start out in January with a gram stain training that will be online via Zoom. That is the one thing we got out last year, and we will be repeating that again. So think about it. Anybody that has a new staff member, and even if you don't do full microbiology, but your physicians have asked you to do gram stain, that is highly recommended to catch up on the gram stain discussion itself. So I will get that information tentatively. That particular date, January 26th, I have as a Tuesday, because I know Mondays are hard for people. A lot of people are gone as they have comp time to fill. So we will try to do our trainings on Tuesdays. After that gram stain training, I envision then doing our rule out and refer. We will start that in February. We will, I guess, again, I envision that being a over the noon hour training. However, it will be a lot longer than just a lunch and learn. This will be an hour and a half training. So if that can be done, not right in the lab, but in your computer lab or a quiet space that people are not interrupted to do laboratory work, is the best way to get through that rule out and refer. Last year, if you remember, I had started the rule out and refer, tried to do it probably in July. Had a couple people that did the Zoom trainings itself, but we did extend it to do work on the LPX challenge, which obviously didn't all happen, and then to take an exam. And I didn't get that far. I only had one or two people that was encouraged or had gotten that far and had asked for that that follow-up in that exam. But I think we started out strong. I had 26 people that signed up for that class, and out of that, maybe one or two that really was able to finish it. So it was a tough year. I'd really like to start anew and make sure that we get you up trained from beginning to end. So I will get that information out on when those two trainings will be for the rule out and refer process, also known as the LRN training. As for the challenge sets, which is more hands-on, that's what it's meant to be, is that once you've gotten the LRN training and know how to do the rule out and refer, or think you know how to do it, then to exercise that process. So you can either do it by the LPX in the larger laboratories. I do highly recommend doing the and signing up for the LPX this year. Their organisms that they use are very good mimics that I can't even use. So I would recommend, if you can at all possible, do sign up for the LPX. If you do not have the ability to sign up for that, I will ask you to complete the challenge set, and you will receive that in probably March and October tentatively. The LPX is tentatively set for April and September for this year to be sent out. Last but not least is packaging and shipping. So a couple of things on that front. We have always had the privilege of having a national speaker here at NPHL. Pat Payne has been with us for 10 years, but last year, because of COVID, she did not travel. And this year, I don't believe she will be back either, and feel that she's probably going to be considering, or if she hasn't already, retirement at this process. So that makes it harder for our laboratories to get packaging and shipping in. There's a multiple other ways you can consider, but here's what I recommend. If you have already been trained once and have been certified, at least at one time, you can up your certification, which should be done every 2 years, because FedEx, if you do any FedExing for IATA training, 2 years is the requirement. And so if you have had that training, CDC does have an online class that can be done. It is better than the one that we've had in the last couple of years. It was so very hard. And I know a number of you have complained about it. And I totally understand it was, because I had done it several times myself. I think it's greatly improved. The newer packaging and shipping class on CDC Train was finally released, I think, in November, October, November. And I do find that the class is a little bit easier, but you still need to know your stuff. And I think it is much better put together. I recommend that then if anybody needs recertification. Now, Safety Pack has been hired by APHL, which is our national organization, and is giving free classes, and they're going by state. So I know that a number of you have signed up. I had, well, we were allowed a quota of 50 people. We hit that quota within 1 day. Have had a lot more interest in it. So I am trying, so of the people that signed up, the first 50, they will be trained in March. Now, if you are still interested in Safety Pack training, that I will be able to fit you in on occasion. So say, for instance, another state is training. They want to train, but don't have the full quota for the full 50. So on occasion, they will let me know. And we have done that. We were able to slip a few in December and a couple here in January. It sounds like February is going to be pretty full for them. I don't think I'll be able to get anybody in February. But I will try again after that if you want that full training for any laboratorian who has not trained before. Finally, as far as packaging and shipping, I believe the way that the CDC and the APHL is going about offering training here in the future, it won't be this year, but they are looking for train the trainers. That is a program that is just being offered to some of the state training coordinators throughout the United States. It's going out to maybe anywhere from 12 to 18 trainers who have been asked to do an advanced study. And those trainers then will go to each of their state and will be able to offer it actually 4 times a year. That is something that is required of the people that take the more advanced class. And so you will see possibly as early as this fall, but for sure next year that we here in Nebraska will be able to offer training at least 4 times a year. We may have other states joining in our class as well, which is great because you get to see a bigger outlook in what other states are shipping and how they're handling their shipping training. What is nice about this newer class, though, is that they're starting to standardize. I believe that before each state kind of did their training their own way. And with the new training, we share the same curriculum as we do with other states. We will be doing hopefully same exercises and exams and so forth. So I think it will be a much better training. It will be live, but on Zoom. So it isn't something that you have to sit down at the computer and can't ask somebody questions. That's the downfall of the online training. So with that, I'll open it up. Does anybody have any other questions about packaging and shipping, about LRN training, about gram stain training? So you might ask, well, what does your laboratory require to be done? If you do gram stains only, or if you do, say, gram stains and blood cultures, I would highly recommend for sure the gram stain and even parts of the LRN training that could be customized for you. If you're doing gram stain only, we do have a gram stain challenge that you can do probably twice a year, because I know that you're also doing some sort of gram stain proficiency. But this particular training will help you in doing that proficiency training. Anybody that does any packaging and shipping, it doesn't have to be for microbiology. It could be for your chemistry tests, your antibody tests, any cancer-related tests. The training's for you, the packaging and shipping. And yes, we do cover quite a bit of category A and B, but there's much there for you to learn as far as exempt packaging, or sometimes what we would consider not regulated. And therefore, it's good to know the difference. And we will cover that in the packaging and shipping, both this year with Safety Pack and then in future trainings through the state training coordinators. So, all right. Quickly, I wanted to just share the social media. I know that a number of you have joined onto our Facebook site, and I have struggled to always get good information out there on Facebook and Twitter. And I'm happy to say that I have a new person assisting with that, Sarah Trotter, who is a whiz at social media, will be taking that that task on, and I think it'll be a lot of fun. So please consider joining our two groups. I think that some of our fun information will be out there, and all of our training announcements will be on those sites as well. I am also excited to announce that we are going to be switching our NPHL newsletter to a new format. As you know, years past, we've tried to get it out once or twice a year as a hard copy format. And that is a tough thing to do, and to make it easier on us and also to give information to you in a more timely basis. We are going to be starting a new monthly digital edition. Some of you have seen it before and have signed up for it, but I will make sure that all the laboratories are now signed up for it. There is a button at the bottom that'll say if other staff members or other hospital employees are interested, feel free to sign up. So I do ask that when it comes out, please share this new monthly edition, newsletter edition, with your infection preventionists, your epidemiologists, your pathologists, as well as any other physician in your hospital. It's something that we would love to share with all of the healthcare in Nebraska. And last but not least, our contact numbers, I've been putting them on our meetings, just so that people know who, what general number to call if for a general question. If you have a stat or some immediate question that needs to be answered, or if you have a possible BT organism, something that is LRN related that you cannot rule out, we do want you to make sure and use our 24/7 emergency pager, which you can find there on our agenda. So I know I've got a few questions rolling in for open mic. So let me start. Emily.
Oh, Karen, I just wanted to mention real quick on the 24/7 emergency pager. If you don't receive a response back within an hour, please page again. We have had instances in the past where incomplete phone numbers have come through, and it's very difficult for us to try to figure out what phone number was actually trying to get a hold of us. So if you do not hear back within an hour, please page us back again, just so that we can, remedy any potential issues with that technology transfer.
And I would say, Emily, and forgive me, I know at the maximum an hour. I mean, if you really need assistance and cannot get a hold of anybody, you could even try, sooner than that, half
Absolutely.
hour.
Yep, absolutely. We always say that we will answer within an hour. That is our longest time limit, but I would personally say that generally occurs much quicker.
Yes, and we certainly try our hardest to do that. We've been known once or twice to, everybody's been so busy they couldn't get to that page or even see it. So that's something that is another reason as to why you might want to call back. So yes, thank you, Emily. That's a great point on the emergency pager. But again, there is the regular phone number. So on a regular business day, that 9444 number should roll over to each one of us until you get a live person. All right, Paulette, thank you for chiming in. It says, could I resend the site for the reporting of the flu, RSV, and COVID testing? We've fallen short in that reporting. Yeah, if you are still not able to get onto the electronic reporting system and have to do it manually, most certainly I'll get you that information, Paulette. So I'll do that after this meeting. I think I'll also get you in touch with Robin Williams, who's not there today, but will be back tomorrow. They have a federal holiday today. So you're installing a new computer system. And so is there any thought that you will be trying to get on a new electronic reporting system? If so, let's talk more, Paulette. Robin and I will be able to help you. From Lindsay, I hope you don't mind, but I'm going to share this with everybody. I know you had just asked me, but about the vaccine working on these new variants. Any thoughts there? Pete and Emily, I know that you could probably speak to that. My understanding is that it's still good with even these new variants because it does target the spike. Is that true?
I agree, Karen. I haven't heard anything to the contrary.
Okay.
So
yes, so far it hasn't. Yes, we're hearing about all these variants. That's like Pete said, it's just what they do. And just like influenza, sometimes it's a major shift in the mutation and becomes a whole new organism or virus practically. So yeah, we'll keep attuned. I know that if it gets to that point, certainly information will be out there fast or as fast as
Karen, the
yes.
UK strain has been tested and is not showing to reduce efficacy of the vaccine. There is currently studies undergoing with the South Africa strain, which is not as prevalent. And I have not seen final determining results from that at this time. But the UK strain, which is the one that is currently starting to make its trek across the United States, is not affected by the vaccine. Or the vaccine is not affected by the virus, however you want to look at that. Your virus should still, this vaccine should still protect you from this strain of virus.
Right. And so, yes, continue to really advertise the vaccine. I hope it's in all your communities. Is there a community out there that is struggling? Have you heard of a lack of response in your community?
Struggling as in you're not getting information or people's response to taking it?
Oh, well, both. Actually, I had initially meant that to mean if you're not, if the vaccine's not coming out in your community. But I realize there's also the other hand where not everybody's willing to take it. What do you hear?
I can speak for Southeast Nebraska would be because all our counties mirror each other, and we've been pretty fast and furious. I think we've pretty much given all the Pfizer that we've got, which is 970 doses. We store those vaccines here, and then the other hospitals come every Monday and pick up their allocations, but they've all been working. Nebraska City, Auburn, Falls City. I mean, we've done it. Most of our employees, most of the police department, most of the EMS, we're working on the 75-year-olds and getting ready for the 65-year-olds.
Yeah. And did I understand too, Pete may know this, that I think we had a HON last week where now the vaccine program is being opened up to even the general population that is over 65 and to people under 65 that would have a comorbidity of any sort. And that would be diabetes, obesity, any sort of immunosuppressed disease that they might incur. So what is recommended in that HON is that group, that phase of population it is recommended you call your not your public health. Well, yeah, your health departments. They may or may not yet have it on their website. You could certainly check that as well. But I know that the state of Nebraska is really gearing up for that as well, if you haven't already heard that information. So anybody else across the state, any information about your vaccine program? All right. Meanwhile, I'm going to just backtrack just slightly. I mentioned if there were any questions for New Alert. I think I do see Brian Lenz on, and maybe some of the other NPHL staff, but any New Alert issues out there in the field? All right. And Diane did say a vaccine was not available at your site. If I remember right, you're down in Auburn. And that's an interesting comment. So maybe that we can look into that. Dan does say that they've started their round of Moderna second dosages this Friday. That's really exciting. And I know that a majority of our staff here at NPHL and here at the medical center also have their vaccines as well. So it's always good to know. Okay. Any other comments, questions, or reminders? Hearing none, we're going to go ahead and sign off early. And we'll leave it as that then. So thank you, everyone,
Thanks,
for
Karen.
joining us.
Yeah.
And if you haven't already, don't forget to sign in the chat box. I'll leave it up for another minute or two so we can get your name on. Thank you all.